Welcoming on stage Dr. David Roze, the founder of Roze BioHealth and international recognized leader, biological dentistry and ceramic implantology. Anne Marshall is a Chinese energetic specialist integrating neurofascial and meridian-based therapies. Can I please have a welcome applause? Thank you so much. Gentlemen, come on board.
Thank you. Thank you so much.
Good morning, ladies and gentlemen. I am Marshall. I practice and teach Chinese energetic, which is about Chinese medicine. And David is an international expert in biodentistry. He has 3 clinics here in Dubai, where people from all the Gulf countries are coming, and actually from all over the world.
Good afternoon, guys. Good afternoon, everyone.
And first of all, I have a question for Dr. David. I want you to take you to your journey and how you have been going through conventional dentistry to biological dentistry.
Yeah, thank you, Marshall. What I see a lot of the time is the patients comes to us, they have lots of symptoms, unexplained medical symptoms. And we want to try to find a way to solve this problem. So just to give you an example, yesterday I had Aliona. Aliona comes, she's a sports coach, she's also a biohacker. So she really knows everything and she tried to find all the treatments to solve medical issues. And after years of treating all the symptoms, she cannot find a solution or cannot find a medical solution for 2 problems. She has bloating and she has a thyroid issue. It's okay? So bloating and thyroid issue, and she cannot find any treatment for that. So she decided to come to us, and basically we found out on a CT scan that she has an infected root canal treatment on one specific tooth. And this specific tooth is linked through a meridian to the thyroid and to the stomach. So the idea is for us to make our patient understand that there is a link between the teeth and the rest of the body. And if you don't solve the infection that you have in your teeth, the root cause, you cannot solve your symptoms. It's not possible. She tried one time to take some antibiotic for 3 days, and the symptoms of the bloating disappeared. And as soon as she stopped, it's coming back. Because the infection or the bacteria that you have in your teeth goes straight to your bloodstream. And then if you still have this infection, it will continue. It's a low-grade inflammation and infection. So that's the idea of having a team all around us.
Okay, thank you for explaining. And so can you explain also us why in your biodental clinic you choose to invite different experts working together?
So I was a conventional dentist. I've been here in Dubai since 2003. And it was easy. I was a good technician. And everything makes sense because you do what you've been taught. And I'm a very family-oriented guy, and I have 3 children. They are now 26, 24, and 22. And everything went fine. The children grow. Everything is okay. And when my daughter got 15, she got cancer. And I didn't understand because we were trying to be healthy all the time. We did everything we could. And when that happened to you, you kind of realize that something is wrong. So we got treated, but life changed. You have to change from what you experience. So we read everything about cancer. We went through different trips across the world to understand and to experience different type of methodology and medicine. And that's when was the trigger point where he decided to, whatever we do, even in dentistry, should make sense. And if you want to find the solution, you need to involve other practitioners. You cannot solve everything together. But vice versa. A doctor cannot solve everything. He needs to find out if there is any infection in the mouth. So we need to work hand in hand. That's why we had to integrate in our practice medical functional doctors, psychotherapists, physiotherapists, and Chinese energetic. I mean, this guy that you're seeing here is a magician, and you need to understand that. He doesn't say anything, he's very humble, but what he does is pure magic. When you are a dentist and you do some surgery, what do? You have some extraction, the patient is very scared, so you prescribe Valium, you prescribe all these kind of drugs to decrease the pressure or the anxiety of the patient. But now, this guy, you send the patient to him, and in half an hour or 45 minutes, he's able to touch the patient, to press on the skin of the pressure, and decrease all the tension of the patient. It's crazy. And then you have different. We used to do wisdom teeth, and it took 4 weeks of healing with dry socket, all these kind of things with antibiotic. Now, in 3 days, it's healed because of this protocol. So you see that when you put the patient in the right environment, it makes a huge difference, and the patient heals nicely. So, I mean, give him an applause for this guy, because he's really a magician. Thank you, Marcia. You're doing amazing.
Thank you. We discussed a little later about the technical aspect of my practice, but I just want one more. I have one last question.
Okay.
It's like, how do you choose people working with you? How do you choose the member of your team? Which values are important for you?
So when we choose someone, first we do a lot of research of the work. It makes sense. It needs to make sense scientifically. And once you have done your homework on choosing the right people, we have 3 values, which are human, elegant, and remarkable. And so when we handpick a new doctor or a new practitioner, it needs to focus on these 3 values. And the human side is very important. If you're not connecting with your patient, it doesn't make sense. You will never heal the patient, or you will never go deeper to understand his needs. So human is the first value. Elegant, it makes sense because it's not the way you look, it's also the way you comfort the patient, the way you talk to the patient, the way you embrace the whole journey of the patient. And remarkable because every single in our specialty, they have a specificity, and they want to grow all the time. So all together, we brainstorm all the time to find the next stage. Now, for example, we have just introduced peptide in dental treatment.
This is the most important, especially for us as practitioners. It's when you work in a clinic where they evaluate your work as a quality, the satisfaction of patients, and not the pressure of the session that we have been through like clinics or hospitals. This is never the fixing the body. And this is what makes this, for me, this clinic very special, and thank you for sharing about this. Now let's start to have some fun together. All stand up. And I have a few questions for you. First of all, please, who do not track HRV, take a seat. Who do not track your HRV? Yeah, the one who doesn't track.
Yeah, almost everybody is tracking, so good. Next.
Who doesn't track sleep pattern, please also take a seat. Okay. And who doesn't track vitamins and minerals, please take a seat. we have a few champions.
Yeah, no, we have a good audience. Very good.
Now we have the extra question. Is who doesn't track gum inflammation regularly? Take a seat. Gum inflammation. Gum inflammation. Yeah.
We have still two.
And who doesn't track regularly the toxicity of the feeling in the mouth? Please.
Yeah. Very good. We have a champion.
We have a champion today.
But you understand the thing is that you cannot heal, you cannot solve all your medical health if you don't track your mouth. It's not possible. So maybe your conventional dentist has done a perfect work technically. And maybe he's thinking that it's the best we can do there, for sure. But I want here to prove you that maybe you have a root canal treatment. Maybe you have an inflammation around your wisdom tooth. And these kind of things affect your immune system. And that's what we want to prove it to you today.
So what is very important to understand is that the mouth and the meridians are connected. Who was aware about this connection between the teeth and the meridian? Very good. Very good. So this is why we are combining our techniques, because the meridian, actually, it's like the motherboard of your human body. So if the motherboard is compromised, it will compromise your organ function. It will compromise your immune system. It will compromise your nervous system, your hormone balances. And this is why it's very important. And also, when we chew, we stimulate the meridians. So if there are some problems in your mouth, you are also stimulating the problem and reflecting the problem in all your body. So yeah, basically we work, this is my part of the job, to work on the motherboard. How does it work? Is your body is very intelligent, and all the tradition of health already understood it 2000 years ago. And by taking the pulse, it gives your body, I enter in communication with your body. And by taking your pulse, it will give information about where energy is flowing and where it doesn't. And my job is to stimulate the intelligence of your body to restore itself the connection. Everything already exists inside your body. And what compromises a lot this energy system is the mental pressure we daily live nowadays. All the emotions that we store in our body is making like overtension in our house. When there is an overtension in the house, all the system crash. And this is what happens in our body when we accumulate all this mental pressure, all this emotional pressure.
And you understand that if you have, for example, in your mouth, some metal, in the metal you have anode and cathode. But in the mouth you have also the saliva. And whatever, if you have a louse in your mouth, you will have corrosion. And this corrosion doesn't stay in the mouth. It goes everywhere in your system. And then you have this kind of issue, because the corrosion goes everywhere and your flow of energy cannot work to the best. We're here to fine-tune your immune system. We're here to help you get better and feel better, because we want you to live like an athlete.
And for us, what is very important is to find the root cause, to really go at the core. So you can try to have the best component, take the best supplement, take many external things, but if your own motherboard is not fixed, then you cannot get to have the best performing machine. And this is one of the book of Dr. David, which just has been published, is called The Hidden Root, because this is very the core of what we do on a daily basis, is going to the root of the problem.
Yeah, we try in the book to explain the relation between each symptoms that you may have. You have back pain, you have brain fog, you have chronic migraine, or you have any kind of symptoms that are unexplained, but then you will find a root inside the mouse, most probably. That doesn't mean that everything comes from the mouse, but if you can change your lifestyle, if you can change your nutrition, you cannot, for example, change the environment. So if you have aluminum in the atmosphere, it's very difficult for you to change that. But at least if you can change the environment of your mouse, that's something that you can do to your health, and that will improve drastically. Just for you to understand, what is a root canal treatment? A root canal treatment is a disinfection of the inside of the canal. But the main canal is just a small portion of the tooth. The tooth is a 3D organ with nerve, with the blood vessel and the lymph. But when you remove that blood flow inside, you remove the possibility to remove the waste if you have bacteria. And we know, all the dentists, even the conventional, know that on a root canal treatment, you will find bacteria, especially on the tubules, the very small channels that are making the tooth. You have 3 miles of channel for one tooth. It's impossible to disinfect that. We don't know how to do it. So these bacteria live there happily and release their poop, release their endotoxin. Endotoxemia is a big problem. And I really want you to do your homework and read about endotoxemia. Because now we know, studies shows that endotoxemia cross the blood-brain barrier. So it goes into the brain, affecting the microglia. You know, the cells that are responsible of the regulation of the neurons and of the brain. 3 miles per tooth. So you understand that we need to make sure that we don't have any bacteria in the body. Otherwise, that affects the whole body. If you go to a cardiologist and you need to have a surgery, the first thing that they will tell you is go to your dentist and remove the infected teeth. That's the first thing that we know, because it's going to cause endocarditis, and that's going to be a risk for the patient. So what do we do if we want to remove the infected root canal treatment? We have 2 options. First option is, of course, the extraction and ceramic implantology to avoid any metal in the mouth. But the second option is revascularization of the teeth, giving life back to the tooth. We take a bit of blood, spin the blood, separate the well cell from the white cells, and re-inject this PLF inside the tooth to revitalize the tooth. So it's a technique that works well. Of course, we need indication. It needs to be a straight canal, but it works. And we are the first one in the region, the whole GCC, to do this kind of technique.
So you can hear this summit to get the best practice about how to live long and healthy. And I hope that now you understand that the most important is to take care of yourself. Because all the intelligence, all the wisdom, all the power is already inside. And the idea is to find a way how not to compromise it. And one important part is the mouth. And something that we do every day is brushing our teeth. And knowing that in most of toothpaste, we will have fluoride, we will have chemical product. So this is also something very specific for David, that he chooses to make his own formula of toothpaste without
any compromise.
And yeah, and the idea of the toothpaste is not only to clean, but also to make the mouth alive. So take care of what you put in your mouth when you clean it. Spend time to liberate your body from the emotion and mental pressure you daily accumulate. And also, something that we forget too much is to enjoy, to have a meaningful life. And this is what the speakers before mentioned, is that this is the only reason why we are alive. And our duty is to maintain our body healthy and to make our life meaningful and happy.
Yeah, I want also to add that we've been very fortunate to live, practice, and work in Dubai. So yes, we have created this formula, these new products, but we wanted them to be manufactured in the UAE to give back to the people of the UAE. And what we're doing also in our clinics is what we call the fair care initiatives. So what we do is we ask all our practitioners to give 2 hours of their time every week to give back and to treat people for free. Not for free, they will not earn anything from that, but the patients will pay only 10% of their treatment. So of course, it's only people who cannot afford to have dental treatment who screen them, but know that we have these kind of things. Because I think it's very important for us, our practitioner, to keep the feet on the ground and to give back to the UAE. I wanted also to show you a small video of the introduction of the book so that you understand why we've done that.
I was 6 when I started orders, lines, boxes and shapes. But for me, it was real. I was learning that part of finance and so I knew my position, so I started by feeling about intuition. It had to be perfect. I wanted to close. I was standing on the other side. Realizing that telling me which one I would use and learning that it works made me simply believe. I always approach the program in the management program. I was engaged and learning things that seem impossible. I heard of surgery after the students. One of the challenges was the program engineer doing this structure. Otherwise, poor feeling, sensitivity is also the case. The one is not a solution. Until I come to it, and then think I was crazy. Suggesting any solution. Our research was wanted to do. He also wanted to do is determination and passion. We made our own consideration.
Thank you so much, guys. If you have any questions for me or for Martial, we're here to answer you.
If you have any questions, please feel free, and if not, we will meet today and tomorrow around the booth. And please get a sign from David. David is signing his book.
Thank you so much. Yeah, you are. What if you have a tooth removed? Yeah. Yeah, so so the question is, if you have a tooth removed, how does it work? What you need to understand is meridians, so the flow of energy, is not, is rarely linked to only one tooth. So you can be linked to two premolars. If you have one premolar removed, the flow of energy is still working because of the second premolar. But because you don't have stimulation in this area, the bone will shrink and it will be less intense in terms of energy. So we recommend to replace a ceramic implant, in this case, to stimulate the bone, to make sure that we have the optimal chewing capacity, but also to increase the dynamism of this flow of energy. Okay, if you have also teeth missing, especially molars, you will end up with swallowing big piece of food. What that means is that your stomach will do the job of your mouth. And at some point, you will have issue with your stomach because it's not the job of the stomach to cut big pieces. So you see, everything is connected. So if you miss the opportunity to restore your chewing capacity, you will have an issue somewhere else. And maybe long time after. You will not notice on the day you remove your tooth, but it will happen. So that's why we need to restore the mouth. Yes. No. No. As of now, what we do is we check the wisdom teeth. If they are, so it's a bit complicated because I have always these questions. Why do we want to remove the wisdom teeth, first of all? The problem is you need to understand the anatomy of the mouth. You have two types of gum. You have the attached gum and the non-attached gum. You have the healthy tooth here, and you have the gum here. That's the healthy way. When you have a connection between the gum and the teeth, it's healthy because the bacteria that lives in the mouth doesn't go inside the system. That's what we want. Around the wisdom teeth, almost all the time, especially on the lower wisdom teeth, you have a non-attached gum. And that's why the bacteria flow there. It's not healthy. Because now if you look at the cancer, each time you have a cancer, there is a new study showing, oh yes, you have bacteria that are supposed to be in the mouth. So no, I don't recommend that. Just to finish on that, and that's why I don't like titanium implants. Of course, there are alloys and there are multiple problems, but the most important things that nobody tells you is that you have the implant, you have the gum. You don't have any door, you don't have any lock between the gum and the implants. So you will always have bacteria flowing there. In between a healthy gum and a healthy tooth, you have what we call two locks. It's called hemidesmosomes. Between a healthy gum and a healthy ceramic implant, you have only one lock, but you have a lock. It's not as good as a tooth, but it's still not as bad as a titanium implant. Yeah. I will always recommend to do a biological consultation that include also a CT scan to see if you have any inflammation or infection in the mouth. I want you also to do your homework because conventional dentists, they are not aware of FDOG. It's a necrotic bone. When you remove the conventional way a wisdom tooth, you will have a necrotic bone almost all the time. So you need to get this information yourself because nobody else will give you this information. Okay? FDOG, it's called also cavitation, it's called fatty degeneration. You have plenty of names, but know what it is and try to find the right indication for that. Yes? Sorry? Thank you. Thank you. So here you're talking about regenerations. Okay. So there is two things. Remineralization of the teeth is constant, meaning the cavities, okay, is just a process of demineralization and remineralization. So when you have a small demineralization starting with a small cavity, you can use hydroxyapatite just to remineralize the tooth. But if you're talking about growing a tooth, that's the latest study that we have is from Japanese studies, but it's just the beginning. And I don't think it will come up today or tomorrow. I don't think so. I've been learning about that for 20 or 30 years, but it's just in the research process now. And imagine that you have a tooth that you want to grow. It will take some time, you know, to grow a tooth, to grow a molar naturally. We see it takes 4 or 5 years. So will you wait for 5 years to get a new tooth? I don't see that happening in the next 20 years. Maybe I'm wrong, and I hope I'm wrong, but for now, what I would understand, I would tell you is when you have cavities, it's because your mouth is acidic. Reverse it to alkaline and remineralize your tooth with hydroxyapatite. Hydroxyapatite, okay? Hydroxyapatite, it's crystal of tooth. So you're adding tooth onto the tooth. Okay? So forget about fluoride and replace that with hydroxyapatite. And the more, the better. Okay? If you have a toothpaste with less than 10% hydroxyapatite, it doesn't work. It needs to be above 10%. You have 3 that I know, Risewell, Boca, and our toothpaste. Risewell, Boca, and our toothpaste. Yeah, of course.
So if you have to rate what's worse for your dental health,
If you have,
if you had to rate what's worse for your dental health, acidity, sugar, or constant snacking. Constantly snacking, I've heard, is very bad for your dental health.
yeah.
Sugar and acidity. Which one is worse?
So I will tell you the truth. The worst in dentistry, if you take everything, is a bad dental work.
Bad dental work, like brushing.
No, like an infected root canal. Because for you, you went to the dentist, you had pain, now you don't have any pain, it costs reasonably a small amount of money, and you can chew. Why would you complain? Because you limit, like the dentist, yourself as biting, chewing, and localize. But the effect on your body of having for 10 years or 20 years an infected root canal treatment is dramatic. It's just dramatic. And we cannot quantify that. But if I tell you that in 20 years you will have Alzheimer or dementia, what will you do? How do you quantify that? If you have tomorrow a breast cancer, you see, 6 years ago or 7 years ago, I went to Dallas to an amazing conference on biodentistry. There was one of the speakers, she was a cancerologist from one of the best cancer centers in Dallas. She asked the audience, we were 700 dentists, she asked the audience, please raise your hand if you have seen one patient with breast cancer without root canal on the same side. And I'm giving you $10,000 right now. Nobody raised their hand. And nobody talked about that. So between snacking and having this kind of toxicity, I would choose the toxicity. Remove your root canal. Or check your root canal treatment. Okay? It's the same. Multiple snacking lead to acidity, lead to cavity. So it's the same. It's just the one step at a time, but it's the same. Stop snacking. It's completely true that if you don't snack, you will let time for the microbiome to restore the alkalinity. But the type of sugar that you eat will also induce acidity. But it's not only that. It's not only your oral hygiene. You can have multiple cavities even if you have a good oral hygiene. So maybe you have a reflux. Maybe you're drinking, I've seen a lot, you're drinking a lot of lemon juice because you're a biohacker and you want to do everything right and you do lots of biohacker. The tooth or the enamel is the strongest tissue that you have in your body, the strongest. But next to the tooth, you have the gum, which is the softest tissue in the body, next to each other. So it doesn't make sense to brush the teeth and the gum with the same instrument. Doesn't make sense. You see? Now, imagine you brush your tooth or your gum with the same instrument, then you will damage the small fibers of your gum, and the gum will recede. You're extremely conscious of your mouth, you do a lot of things, but you're damaging yourself, your mouth. And then your gum receding. But then the root is exposed and is not covered with enamel. It's covered with cement, which is very soft. Then you will have, sorry? If the gum has receded, yes, you have techniques to restore it by gum surgery, for example. Yes. But you restore ad integrum if you don't have any chemical on the tooth. If you have asked your dentist to cover it up with a filling, then it's too late. So the only thing is educate yourself, because you won't have all the answers by your dentist. And even if he's a great technician and he wants to do the best for yourself, what he has been taught is not accurate now anymore. It's just think locally. Don't think tooth, think globally. You're a human being. Do you want to answer?
So you were, just to recapitulate, you were mentioning about technical theories.
Whatever you were saying,
Yeah.
But in your talk, you said about
Microbiome,
biome and you said
energy, yeah.
So when I heard the word energy, I thought more about the traditional Chinese medicine, because they talk about pressure point on the surface of the skin, which can do effects on the organs. But when you started talking about microbiome, there's so many books around, like your 90 to 10% human, then microbiome determine your 90% of the bacteria, which are oral genes. That's a different science. So I'm still confused which place you guys are coming from, traditional Chinese medicine extension or the main Chinese medicine, which is microbiome.
The thing is, I don't want you to put me in a box. You have an acute infection, you have an abscess. I'll go straight to Western medicine. I give antibiotic. You have a chronic inflammation. I go straight to Chinese medicine. So I'm not here or here. I try to find the best way to be less invasive, less chemical, and the best treatment for the individualized patient. We're all different. We're completely all different. What works for you will not work for the other one. What I see is before a treatment, or if your patient has a lot of stress, rebalancing your body through Chinese energy, which is non-invasive. Yeah.
I understand.
Yeah.
But still, like, because microbiome, I don't call it Western medicine, I say research-based mainstream medicine. But I right now I'm a trainee who has graduated from China, the medical college, and she keeps telling me about the Chinese medicine. So I was asking her what is it. She was explaining me. So when you say the energy,
Actually, both systems, they are working together. Because your energy system defines the way that the function of your body works. So then, if your energy system is nicely plugged and the energy flows, then the function of your body will work at their optimal level.
It's more of a traditional Chinese. I believe in that because I'm reading a yoga book from Harvard, and it talks about that Chinese were the latest one who accepted dissection on the human body because they believe that energy will be exposed, yeah, or they will have not that concept. It's more of the Chinese method, yeah.
Yeah, but I agree with you, Marshall. Everything is connected. So a conventional dentist will focus on the microbiome and will focus on the occlusion. Okay? Why? Because when you have a day, on one specific day, you will have 20,000 contact in your teeth. Each time you chew, you have a contact with your teeth. Each time you swallow, you have a contact with your teeth. That impulse stimulates your meridian. You understand? So each time you have a flash of energy that goes to the meridian. That's why we need to combine both. And after that, if you have an imbalance in your microbiome, you need to rebalance it because otherwise it will affect the whole body, especially if you have bleeding gums, because then it will penetrate inside the body. I hope I... Yes, exactly. Yeah.
Exactly, and to get to this point, for example, for food intolerances, so, and the leaky gut, it's that the small intestine has not the capacity to filter. So there are some parts that enter inside the body that do not need to filter. And again, in the energy system, you will find a deficiency on the small intestine, making that the filtering system is not tight enough, and some bacteria, molecules that enter the body, which that shouldn't. So then it affects the microbiome. So that's why it's a combination. Both systems exist, and actually they work together. It's not one or the other, they work together.
And something else that I want to add, because here in the UAE, we couldn't test properly our treatments. In Europe, they test it. And I see Dr. Najat, and I want to talk about that, Dr. Najat, because they're doing that. If you have a knee pain, unexplained knee pain, in Europe, when you're a biological dentist, you will be treated through procaine. It's an anesthetist. But then you will inject the root cause, the tooth that is causing this pain, and for 2 hours, that last anesthetic, the procaine, you won't have any pain in your knee. Funny. Here, we were not allowed because procaine is considered as a derivative of cocaine, so they didn't want to do that. But there is one clinic in the UAE who can do that. And really, it makes sense because if you have an unexplained medical symptoms, going to a Dr. May clinic makes a huge difference because then you will find the root cause. If you have some hesitation, for example, then you will see immediately that is linked to this disease or to this pain or symptom. So you see, everything is connected. You cannot work on your own. It's not anymore possible if you really want to do that. But you're part of the equation. If you're not doing your homework, you're not helping. You need to find out and build up your own medical report because it's all the symptoms that you will describe that guide us and lead us to find the root cause. So it's a little bit like finding the symptoms to determine the root cause. Sherlock Holmes. Yeah.
Can I ask the last question, please?
We have one here. Yeah. Yeah.
What I understood the whole presentation is the fact that you have a very holistic approach to solving the problem. Fair enough that now this considered considered the least important society is to have coffee and a lot of other things. Now, what I have two questions what's here. You spoke about conditions that we could have, diseases or illnesses or conditions as a result of neglect of mouth. So is the sleep apnea one of them?
Yes, true.
Can be included because what people are first, because migraines also can stem from
Yeah.
a bad oral hygiene or nerve
Exactly.
nerve
No, but that's definitely part of the treatment. So we have a sleep apnea specialist because it makes sense. So what you need to understand is that when you have a child and you see that he has dark circle under the eyes, okay, he's most probably with a small nose, he will probably breathe through the mouth. If he does that, he will not sleep correctly, but the problem with that is that he will not develop his maxilla, okay, because the tongue will not position in the right area. And that he does that for years, and it ends up with a short maxilla. And because he has a short maxilla, he won't end up with a good occlusion. Everything is a consequence of just that. So we need to find the reason why he is a mouth breather, for example. No. Again, many reasons. That's why you need a specialist who can find the different reasons. Same, we have a TMG specialist because you can have so many things with TMG. So everything is connected. But if you have people all around you that helping you find the root cause, then you're most likely that to help your patient.
So regarding the sleep is deeply connected with the central nervous system and the capacity of the parasympathetic system to enter into action. So when we regulate the meridian, it has a direct effect on the nervous system too. Means capacity to accelerate when we need to accelerate, but also even time to brake when we need to brake. So this is then how I work with, for example, the apnea or sleep specialist, about that we see from all the angles where does this sleep disorder come from. Is it mechanical? Is it emotional? Is it mental? Is it a lifestyle issue? And then we can guide the person to the best treatment or to change the lifestyle into that. Thank you for all your questions. We can meet at the booth and we can answer all the questions for today.
Thank you guys. Thank you so much.